Okay, so we're going to talk about how to take care of your incisions after either a facelift, neck lift, or upper lid blepharoplasty. I'm going to show you both. You want to have your Q-tips, your ointment, some gauze for if you need, if anything drips. Gloves aren't mandatory. If you have them, that's fine. And here's your hydrogen peroxide. Now you're going to take the hydrogen peroxide and you can either just pour it right here into the top in order to have some liquid for you to dip your Q-tip into, just like this, right? Because you really want to get this nice and saturated. Or you can go ahead and just pour it right into a small little cup. You know, just make sure everything is clean. Doesn't need to be sterile, but obviously clean. And I just use a little paper towel here to have an area that's gathering everything. Okay, so for the eyes here, the goal here is to just touch the incision line and let the peroxide do what it was meant to do. And if there's any liquid that's coming down, you can even have your patient just hold a little gauze right here. And that way you can just slowly but surely just let the peroxide, and you can see there's a little mark right there, right? And if you gently, not too much, but you can gently wipe and get away that crust. And if you're if you're a little concerned about whether or not you should, don't do it. And then right here, there are some sutures on the side right there. And I'm gonna flip my Q-tip over and then make sure it's really nice and saturated, and just sort of almost leave it right on it and let the scrubbing bubbles of the hydrogen peroxide eat away all of that. Good. This looks great. Any pain, or it's okay?
It's okay. No
Perfect.
pain.
Good. And that's one eye. And then we'll turn over here to the other eye. I'm going to use a new Q-tip. I think you get the idea here. Just going to gently touch it. Let the peroxide, and you never want to wipe up or down, but wiping sort of like this is fine. And then right here again does the trick. Perfect. Good. So once that is all done, then we're going to use the bacitracin ophthalmic, and just to put that on top, and you're going to take just a little bit, put it right on like this, right on the end, and then with the eyes closed. By now, everything you've put on is pretty much dried as well. And you're going to just gently put it on the eyelids on both sides. It's a ophthalmic bacitracin that we've given you, so worst case scenario, if it does get into the eye itself, it's totally fine. You can use the other end just to scoot away any areas that might have gotten lower or higher than the incision line. And that's it. That's how you take care of the eyes. Okay, and this is how we would clean the incision line for the face or neck lift. Same idea. You're just going to roll the Q-tip, which is very heavily saturated with the peroxide, along the suture line, and just gently wipe. Don't be too aggressive. Obviously, if it is uncomfortable for the patient, then whatever you're doing is too much, okay? But you can just let the peroxide do the work here. And she really doesn't have much of anything here for me to even demonstrate the peroxide taking off any crusts. She doesn't really have any scabs here at all to take off, but this is the motion, and you can just keep it on like this, like that, behind the ear. And then once that's dry, you'll have a gauze. You can use a gauze, or you can just use a dry Q-tip and just roll over here, that's fine. Good. You're going to take the ointment that we had. I just squirted out onto my hand here, and then scoop it up here with the Q-tip and just put it on here. Nice thick layer, but spread it around so that it doesn't have to be really that thick. And you're just going to spread it behind the ear, in a little bit in the hairline, just on top, and you're keeping the incision line and the flap nice and covered with this antibiotic solution, antibiotic ointment. And then again, if you got some extra, you can just use the other end and wipe it away. Beautiful. Perfect. Great. Now, if you don't have anybody to go ahead and clean your incisions, you can just take a cotton ball, dip it in the hydrogen peroxide, and then, using a mirror, you can go ahead and just apply it directly onto the incision line. Just dab it, and that should go ahead and easily clean it up very easily. You don't want to wipe too aggressively. You can just touch it, and that will dissolve all of the crusts. And that way you can do it yourself. Okay, so after a day or two, you're going to be able to start putting on the arnica cream. And the arnica cream is specifically for bruising, okay? I've washed my hands and sort of used some alcohol, so I want to reassure you, you don't need to have any gloves on to do this. And you're just going to ever so slightly place this on any area that is red, and you're going to gently glide your fingers downward like this. So you're doing a combination of applying the arnica gel and doing something called lymphatic massage. And lymphatic massage opens up the lymphatic channels, which are sort of the drainage system of the body. And it's allowing that swelling to work its way down. Not to mention that the patient is going to really appreciate the gentle massage. Make sure that I emphasize the word gentle. So you're using the arnica gel to gently work its way into any area that's discolored, and at the same time, gentle pressure down, gentle on the flap, and then down into the neck itself, so that you get the lymphatic system is draining. Perfect.